Welcome to our video tutorial series. Tonight we're going to talk about lower facelift. So what is a lower facelift first? I get asked by patients all the time, what exactly does a lower facelift improve? And so it's a little bit of a confusing term, the term facelift. And I think in today's age, most people have divided the procedures into brow lifting or forehead lifting, mid-face lift or cheek lifting, which we deal with through autologous fat transfer primarily and occasionally lifting procedures. And then the term lower facelift is really allocated to what's termed lower facelift. So rather than just saying facelift, we like to go ahead and differentiate that and call it a lower facelift. So what that improves is basically everything from the corner of the mouth on an oblique line to the top of the ear. So that includes the jawline, the jowling, and the neck. That's what we're going to be dealing with a lower facelift. So what components go into the aged appearance of a lower face? Part of it is just a little bit of sagging skin, although it's deeper than that. The skin really falls because of the fibrous and ligamentous structures of the face that have become lax over time and have descended. It's something called the SMAS, or the submuscular aponeurotic system. And that system of fascial layers attaches from the jaw up to the cutaneous, up to the skin. And so certain cardinal things happen related to that. So the jowl falls in a defined position because of where the SMAS attaches from the deep bony areas up to the skin. So when we're doing a facelift, we really need to be addressing the SMAS, or getting underneath that layer, releasing those ligaments, and then returning the SMAS to a more youthful position in order to get the skin changes that we're looking for. So the SMAS is key to how we're going to be dealing with a facelift. Same thing goes on in the neck. The SMAS in the face is analogous to the platysma muscle, which is a thin sheet of muscle in the neck that goes from the collarbone up to the angle of the jaw. When you see somebody who has significant facial aging, you'll oftentimes see these two bands in the neck. And what that is that's the platysma muscle that's separated over time and descended, leading to these bands that form in the neck. And so, as same part of tightening the SMAS, when we do the lower facelift, we're going to be tightening that platysma muscle. So how we achieve those things is we usually, and not in everybody, we do all different kinds and ranges of facelifts, everything from mini facelifts or S-lifts that just involve little incisions in front of the ear, to extended mini facelifts that involve incisions that go completely around the ear. The difference being that the S-lift or real mini lift is just intended to improve the jowl, versus the extended mini facelift we do and improve both the jowl and the lateral parts of the neck. And then we do a complete facelift, which includes a submental incision and improving the neck fatty tissue layers, perhaps if needed, the platysma muscle, as well as the lateral face. So those first two facelifts, the mini lift and the extended mini lift, are easily performed in the office with local anesthesia supplemented by just a couple of pills to provide a little pain relief and a little anti-anxiety effect. The latter facelift, the main one where we're doing the neck liposuction, what's called a platysmoplasty, as well as the lateral face, we do those at an outpatient surgery center, and we use intravenous anesthesia to handle that for the patient. So if we're doing a complete facelift, we start by making a small incision under the chin called a submental incision, where we elevate the skin to preserve a fatty layer on the skin surface. Then, if needed, we'll perform some liposuction to remove any redundant fatty tissue in the neck, and that then exposes that platysma muscle that we talked about. When we deal with that then by making a small back cut where we want the platysma muscle to come up and support the undersurface of the chin and upper part of the neck, and then we tie that together, called application. So we'll bring that muscle together, tie it to support the undersurface of the chin. We then move to around the ear, where we make our incision in such a manner that it basically is invisible. We want to preserve this tuft of hair. If this tuft of hair becomes elevated, then you have a patient who looks like they had a facelift done. So we really want to keep this hair in the right position. So we bring our incision just underneath that tuft of hair, then just in front of the ear, and then we don't want our incision to come all the way in front of the ear where you can see it. So we're going to come just around and in behind this part of the ear where the incision is hidden, then just out into the crease of the lobule, up high behind the ear again, Coming across low behind the ear, you can see the incision, but if you come up high, then you can jump back into the hair and down the hairline where the incision's invisible. And then, of course, when you do the procedure, you want to make sure that you put things back so that you don't get things like pixie ears where the earlobe is pulled down. So you can look at our before and after gallery, and you'll see our facelift incisions are incredibly hidden. People can wear their hair back in ponytails, however they want to wear it, and the incision is basically invisible. The ears have been returned to their natural position, so we really want to produce natural results. Then, through that incision, the lift is really performed again basically on the SMAS. So we elevate the skin just far enough to get to the SMAS, and then we come underneath the SMAS layer, releasing those ligaments gently, and then that SMAS layer is a nice, firm, adherent layer where we can put a fair bit of traction on it in a superior direction to elevate the neck, elevate the jowls, clean up the jawline, and then secure that SMAS in position. Then the skin just kind of comes along for the ride. We remove any redundant skin only so much that it just lays together. We don't want any tension on the skin at all. Tension on the skin only produces unnatural results and bad scars. So the skin just lays together. We use tissue glue, or what's called Tisseal, which is the last two molecules that your body would use in the cascade of enzymes to stop any bleeding that you have. It's produced in a lab, comes in a syringe, and we spray that underneath everything. We hold it in place, and 3 minutes later everything is all stuck down. Then we just use fine sutures in all of the incision lines to just hold that last layer together, followed by just a light wrap that you keep on overnight. The first night, come and see us the next day where that wrap is removed. There's no drain tubes. We don't make our patients wear elastic bandages for weeks on end or at night or wrap them up again or any of those things. As long as you do a good job surgically, the wrap the first night is just there to catch any little bit of oozing that may happen from the incisions, and then everything else should take care of itself. Recovery from a lower facelift, most people have bruising for about 7 to 10 days, and following that, they're free to return to any social activities that they would want to. Now that doesn't mean that's the final result. We talk about recovery in terms of social downtime and when everything is complete, or the completed downtime. The social recovery from a lower facelift is about 7 to 10 days. And then you will see a reduction in swelling and contours and improvements in things for out to about 3 months following the procedure. But as far as getting back in social life, it's about 7 to 10 days. So I think that's everything you need to know about the basics of getting a facelift accomplished. If you need to know more, we'd be happy to talk to you. Please feel free to review our photos, and I think you'll see that our results are significant and natural. Thanks.